Once you have your baby on the breast, take a couple of deep breaths. When you're first starting breastfeeding, you may find that there is some discomfort. This is new for you. And one thing you might notice is that your nipple is being stretched. You will get used to this after the first few days. The other thing is you may feel the milk ejection reflex. So when oxytocin is released in the brain and communicates with the breast to deliver the milk, that's called the milk ejection reflex. And some mothers will feel that. This is something you'll notice less as you continue to breastfeed. When the baby is on, if you are finding that the latch is not very comfortable, one thing that you can try is to pull in the baby's hips closer to you. This will change the baby's angle. It will bring the baby's chin in deeper into the breast, and the nose will be coming away from the breast. Remember, we want to make sure that the baby is suckling on the areola below the nipple and not on the nipple. We don't want the nipple in the middle of the baby's mouth. You might find this little adjustment really adds to your comfort. Another trick that you could try is you can pull down on the baby's jaw just a little bit, and this will allow for a little bit more areola to go into the mouth. When you're bringing the baby to the breast and using this position, once the baby is on, some mothers may find that they are able to relax both hands and change their position. Other mothers, depending on the size of your breast or the baby, may find that you still want to continue to provide support throughout the feed. For some mothers, there are times when you feel like the baby cannot get onto anything other than the nipple. One other trick that you can try is to squeeze the breast, and this is called sandwiching. And then when the baby comes with a nice open mouth, you want to line that up with the way that you're holding your breast so that you can see that the baby is going to be taking in more than the nipple, but also taking in the areola. Remember to always release the hold on the breast once the baby is on. You never want to put a lot of pressure onto the breast while breastfeeding because this can result in plugged or blocked ducts. One other tip that many mothers find helpful, particularly in the first days, the early days when babies tend to be sleepy, is to compress the breast during feeds. When the baby is feeding, you can just squeeze the breast, sort of like squeezing a bag of milk. When squeezing a bag of milk, you'll notice more milk coming out the hole. When you squeeze the breast, this will give the baby more milk during that time. You'll see the baby is drinking more. Once the baby has stopped drinking, then you can release and take a break, and then in a few moments you can try to compress the breast again.